Hi, I'm Cindy Rifenburg, and I'm an occupational therapist. I teach at Lehigh Carbon Community College in the Occupational Therapy System program. I've worked as an academic fieldwork coordinator for 24 years, and I'm putting together just a few little videos to give you some tips on how to work with students when they're out on fieldwork level 1 and level 2. So this session we're going to talk a little bit about how to prepare yourself and your environment to be ready for the student to arrive. So first, let's talk a little bit about setting up the learning environment. The first thing you really want to think about is preparing yourself. And that means reflect a little bit on the mentors that you've had in the past that you have felt have provided you a very positive experience, and also reflect on those mentors that you found challenging. Those challenges could be based on your learning styles, based on the dynamics between you and that supervisor. But it's important to reflect back on both those individuals who have had strengths and those who have felt you have not matched with and have had a more challenging relationship. That helps you become aware of the things you may encounter as you work with future student interns. It's also important to utilize the American Occupational Therapy Association's resources. There's a number of resources that you can access online, and you can also attend Fieldwork Educators meetings that AOTA does provide. You can also attend Fieldwork Educator meetings that are offered by academic institutions, and the academic fieldwork coordinators at a number of colleges and universities are very willing to come and provide information to help you get ready and learn about yourself and how to set up the student's environment for their fieldwork. So let's talk a little bit about learning about yourself. It's important as a fieldwork educator to know about yourself. That means your own learning style. You can take a number of learning inventories. Those are available online, as well as there's a number of books available on learning styles. But you can think, are you a visual learner? Do you like to review handouts and look at materials, read? Are you more of an auditory learner? Do you like to hear the instructions given? Are you more of a kinetic or kinesthetic learner? You like to be doing and be engaged? Are you more of a verbal learner? Do you like to discuss how the learning process has gone? Do you like to discuss the activities that you're using? And also consider if you're also a social learner. What I mean by social is, do you like to feel part of the group, or are you pretty happy working quite independently and alone from some of your colleagues? Also, are you a learner who likes to be supported, or are you more independent in terms of researching materials, trying new techniques? That's important for you to be aware of too, because that's also going to impact how you interface with a student intern. One other important thing to think about is your teaching style. Our teaching style very much impacts how we work with learners. So when we talk about a teaching style, again, there's a number of resources that are available for you to learn more about teaching style, but teaching style can include things like, are you viewed as the expert? That you have a wealth of knowledge that you need to share or impart to a student intern, and that's very important to you? Are you seeing yourself in a position of authority? That because of your experience, you're in a position of power, and that's really important for the student to show respect to you. Are you a modeler? Does that mean that you like to lead by example? And you may not discuss all the things that you're doing, but you are going on the idea that the student is observing what you're doing and following your behavior. Are you a facilitator or a guide? In that particular case, you might be asking more critical thinking skill questions. You might be allowing alternate methods for performance of specific skills or abilities. And a couple other things to think about, are you a delegator? If that's also part of how you teach, if you're a delegator, you're going to be assigning certain tasks and expecting competence and completion of those tasks. And again, all of those are considerations in how you may work with a student on their fieldwork. Now, as you consider these things about yourself, are you able to also convey this information and help develop problem-solving skills in your future learners? Can you expect a student to do it your way, or are you open to allowing a student to find their own way? Each fieldwork educator has to know that we are nurturing and supporting future professionals, but they aren't going to be exactly like us. We need to help them find their path. Also, when you approach a learner, some students may identify that they feel intimidated. think about your own approach to a particular student intern and how you come across. We do want to support our learners. That doesn't mean that we don't set limits and redirect behavior, but we do need to make sure that we're supporting their learning needs. Our ultimate goal is that they are going to be an independent practitioner. Now, how do you prepare for the student to actually arrive? On an earlier video, I had talked a little bit about how important it is to set up behavioral objectives and be ready with that information, whether it's for a Fieldwork Level 1 experience or a Level 2 experience. Once you've got those behavioral objectives in place, then you want to start working on creating a student manual. That's usually a fun task. Here you want to put together samples of documents that your facility uses, whether it's evaluation forms, different types of assessments that you use, sample progress notes. All of those things should be included, as well as an orientation checklist. Usually the facility's mission is really helpful to include. Abbreviation sheets. And when I mean abbreviation sheets, which approved abbreviations are you allowed to use at your facility? Because it does vary, and not all agencies use the same types of abbreviations. It helps to have a weekly supervision form in place. That's the form that you're going to use to formally meet with the student once a week and give them feedback. It's helpful if you have that in the manual in the beginning so the student knows what that form is going to look like and they're familiar with the form that they're going to see to be receiving their formal feedback. You can also ask that student to complete that feedback form on themselves, so when you do come to your weekly meetings, you each have material to share. You're also going to want to include maybe a tip sheet for using electronic documentation or a tip sheet for keywords. Sometimes in behavioral health or outpatient pediatric centers, there's keywords that we want to be able to use. If you provide some of those keywords or tip sheets for the student intern, that's also very helpful. A few final things. Include the assignments. Give an overview of what assignments you're going to expect your student intern to do. That might be a case study. It may be an in-service. Perhaps they're creating a brochure or fabricating a piece of adaptive equipment. I mean, there's many options to choose from, and some of those will be based on your needs in your own facility and also working in collaboration with the academic institution that the student is the intern from. They may have some suggestions to guide you. Also, a sample weekly schedule and even a daily schedule can be very helpful for the student because they do need that kind of structure. It's nice for them to have an idea of this is what my day is going to look like. I might start with ADLs in the morning and then progress to other types of activities throughout the rest of the day, if that fits your center. But having some type of structure the student can use as a guide is really helpful. Now, let's move to actually having the student getting ready to arrive. Hopefully, you've been in contact with the student through mail, email, phone calls, whatever works in your center, so that you at least have been introduced to each other. From there, when the student is actually arriving, it's nice to have a space for them. I realize that's not always possible. Some clinic departments are very tight for space, or other clinicians are on the road constantly day-to-day traveling from school to school. But if you provide some type of option for the student to say, hey, you can put your things here, or this will be an area for you to do some of your work, that can take a lot of the stress off of a student. It helps too to write a quick little welcome letter. I've had some of my fieldwork educators write some really nice little welcome letters. That doesn't mean that it's all flowery. It's also business. You're going to set some of the ground rules about what you're going to expect that student to do. And things like, this is the number you contact if you're going to be late or if you need to be out because of an illness. But it's nice to have a little welcome, let the student know that you've been thinking about them and welcoming them for their first day. Next, you want to learn about your student. Once they've arrived, hopefully in the first few days of their fieldwork, learn about them. Find out what's motivating to them. Maybe why did they choose occupational therapy? What's their learning style? Is it similar to yours? It may be very different, but they may also be a visual learner or perhaps a kinesthetic learner or an auditory, but find out their particular learning style. Find out what things make them feel good. Is it better if they receive verbal feedback right away? Do they like to have feedback later when they can ask more questions? Do they like it to hear when they've done something really well? Sometimes people respond much faster to that type of feedback than other forms. Also, give them a really thorough orientation. Make sure that you show them around the facility, let them know simple things like which bathroom they're allowed to use, where to park, and then as you move along, introduce them to the staff. Of course, they're going to have a little challenge keeping track of all the new names, but they'll eventually figure it out in the next few more days. So give them a few tips to get them started. And also, I'm going to talk a little bit about some basic do's and don'ts. And these are things that I see that come up quite often amongst fieldwork supervisors. Things that they might not even realize that they've done and or said to a student intern. But it's important to be aware of them. The first couple of things are some really nice do's. Do provide clear organization, objectives, and structure. We've talked about having those behavioral objectives ready. We've talked about having a weekly schedule or even a sample daily schedule. That kind of structure can make such a difference for a student. Do provide some examples. What I mean by examples is if you have a couple of evaluations that you can print so the student can see what those look like. If you can print some sample progress notes or daily notes, print those out, put them in the student manual so the student has a resource to look through and give them some tips and ideas on how to put together their first documentation on their own. Allow them to make some mistakes. I think everyone gets that when you're a student intern, you're nervous. You sometimes aren't even sure you know these things, even if you've covered them in your academic environment. But allow them to make some mistakes. Help walk them through. Help them talk about what might not have gone so well. What could they do differently? Those types of things help move the student in the right direction. Provide feedback. Always, always provide feedback. Again, you're going to have to talk with the student about what is the right time for feedback. Do they need to hear it right away? Is it best for them to hear it at the end of the day? Obviously, if it's a serious safety situation, you need to intervene right away. But other times it may be more comfortable for the student to talk with you when they have a little more time instead of quickly just in between clients. And do ask for the student's clinical reasoning. Find out why they've decided to do what they're doing. It doesn't mean that they're going to have all the right answers, and it doesn't mean you have to tell them that the answers they have are wrong, but bring them along. Ask more questions. Say, well, I was thinking this. Tell me a little bit more about why you chose that. You want to nurture that clinical reasoning. You don't want to make them feel discouraged, and they're certainly not going to have the level of clinical reasoning that you do as an experienced practitioner. Now, recognize that you are also going to make some mistakes. I think many fieldwork educators are nervous about taking on a student intern because they feel like they need to do everything right. So as much as a student intern is learning on their fieldwork, so are you. As a fieldwork educator, you're going to have some really challenging times and some easier times with students. But there isn't a perfect method for any student. You have to modify your style and your approach with every student you're going to work with. So be gentle on yourself because you will make some mistakes along the journey and you'll have grown from it also. Okay, let's talk about a few don'ts. And I only listed a few, but I'm sure there are many more that some other fieldwork educators can identify. Let's talk about some simple ones. Don't expect them to learn as you do. Each individual has a different learning style. And just because you like hands-on, they might like to observe first. They might like to watch what you do before they jump in. They may need a little bit more encouragement than perhaps you did. They may not be as willing to test the waters because they're afraid they're going to do it wrong. So again, don't expect that they're going to learn the way that you do. Don't assume that they're going to value the same things that you do. You might value the opportunity to learn a new technique or to go out and do a co-treatment with another clinician. They may also enjoy that, but that may be overwhelming and they may not value that as much at that time. You might offer up the opportunity to go attend an association meeting in the evening because you're excited about attending your state association meeting or local district meeting. They may be overwhelmed by that and not value that because they're trying to keep up with the assignments they're required to do for their fieldwork. So again, it's not that they don't appreciate some of these learning opportunities, but they may not value them the same as you do at that time. Also, don't assume that they're going to be your best student ever or your worst student ever. And please do not compare one student to another. Not using names and certainly not sharing examples of how the worst student you ever had, how they performed. That makes any student feel very uncomfortable, especially if you specifically identify the school that that student might have come from, and it makes the student feel awkward. Also, don't assume that they're going to be the best ever, or talk to a student about the best student you've ever had. That makes it so the student feels like they can't live up to that expectation. Take each student where they are. They don't need to be compared to someone who has not done well, and they don't need to be compared to someone who's been the best you've ever had. That's for you, as the fieldwork educator, to know. It helps you learn about really what are strengths in students and what students do show some weaknesses. But that doesn't mean that you have to say it to the other students to make them feel uncomfortable. Also, last piece, don't make excuses for students. All students have challenges, whether it's sometimes time management, whether it's sometimes picking up on safety quickly, whether it's behavior, professionalism. All students have different challenges at different times. Some students will pick up documentation very quickly. Some students will be much better with their therapeutic use of self. So allow students to grow. Each student will be different. Don't make excuses for them. That may not be a strength for them, but if it's something that is expected in your facility, a certain level of proficiency to be an entry-level practitioner, then you need to let them know that they need to continue to work on it. It's through that feedback that they'll be able to grow. Let's talk about guiding the learning experience. When a student first arrives, they're usually a little bit nervous, whether it's their first rotation or their second. It's still a new placement and you're still a new supervisor. So as you start out with clients, try to select clients that are not your most complex. Try to select clients that are a little bit easier to work with right from the beginning. Get the student in there, get them engaged. Follow a specific learning process. Every institution has different suggestions. The ones that I encourage our fieldwork educators to use is to first let the student observe what you're doing. Watch the techniques that you're using, whether it's working with a child or an elderly client or in behavioral health. Let them see how you handle things. Then ask them to try the techniques or the procedures. Sometimes they can try those techniques or procedures on a fellow staff member if necessary. Then have them move on to trying those procedures or skills with a client. You're right there, you're providing guidance and feedback, and they may need to practice those techniques multiple times until you really decide that you feel safe with their procedure and their competence. Then you can go ahead and allow them to move on to demonstrating that skill or competence on their own. So again, we're taking them from observing, hands-on practicing with feedback, to hands-on with more independence. Don't skip those steps. Don't assume that they can dive right in without first observing how you perform the activities. And all along the way, do remember to ask about their clinical reasoning. Find out why they're doing what they're doing. What are they basing it on? How could they change it? Those are really important skills to prepare practitioners. And feedback all along the way. I hope those tips were helpful in learning how to set up the environment for the student and learning about yourself as a learner, as a teacher, and getting prepared for occupational therapy assistant students or occupational therapy students on fieldwork.